Morning, everybody. Thank you for coming. Welcome to those of you from the public who are here. We have apologies from Mike Richards, Kay Sheldon, Lewis Appleby and Paul Corrigan, all with different but very good reasons for not being able to be here. We then have the minutes of the meeting of 22nd of June. Are they a true and accurate record of everything we discussed? Okay, we'll take that as
Yes.
As a yes. That's good.
Yes.
Yes. Thank you, David. Thank you. Positive affirmation. Thank you. There's then an action log and matters arising. Jane.
Thank you, Chairman. There was a matter arising about Health Watch England. We were talking at the last meeting. We had an update on Health Watch England, and there was talk about a document called a common intent, common statement of intent. And I was sent away to find out, was this meant to be coming to board? Apparently, it wasn't meant to come to the board for ratification. But just in case you're interested, it has now been uploaded onto our system. So if board members would like to see it, it is there for them to have a look at it. But it's not. It wasn't for formal ratification by the board.
Perfect. Thank you very much indeed. Okay. Anything else anybody wants to raise? Action log. I don't think there is anything we need to pick up. There nothing scheduled for today. I was just going to, before we get into the agenda properly, and it's not really a matter arising, but I just thought it was really worth celebrating. Two bits of rather nice news. First, Andrea, you got an honorary degree from Leeds for your work over a period of years, but including particularly at the CQC.
Thank you. Yes, I did.
And I was basking in your reflected glory because
and I'm feeling very embarrassed.
Yeah. And then,
yes.
Which
Thank you.
Just brilliant. And then.
Jacket,
Yeah. And Robert also got an honorary degree.
I did.
And.
I've gone quite as pink as me, though.
And Robert's was an honorary degree in law, so that's rather good. So now you actually qualified.
For a change, yeah. Better than my first effort.
Yeah. And then more worryingly, the Royal College of Surgeons on the due, and I think that does not entitle you to do surgery.
I certainly hope not.
But I just think it's really good when we get lots of brickbats, but it's nice that some people recognise the great work that both of you have done. So, great. Good. David, Chief Executive's report.
Good morning, everybody. So there's a mixture of things which are internally facing and a number which are externally facing. A significant number have been to the board before, so I think colleagues will be cited on this. So I'm going to do some of those at some pace and not dwell on them. So I'll not touch on performance because there's a first quarter's performance report is the next item on the agenda. Adult social care, two important updates. One is the outcome of the symposium that Andrea and her team led on care home closures, urgent care home closures involving a whole range of organisations. NHS England, amongst others, has now been concluded, and a document which sets out how each agency will act if that action is necessary. Has been published yesterday, which is helpful and constructive, and it should ensure a much more coherent approach to care home closures where that's required for whatever reason. It doesn't just have to be for regulatory action. And also developing some work for to support people who make a complaint who might be frightened to do so because of any fear of reprisals. It's something that's often said about hospitals and care homes, that people don't feel empowered to complain because they're frightened that there might be a consequence for their relative, family member, friend. So that's an important development which will take place. I'll not touch on PMS and hospitals, which is about performance. Next item just to reflect on is the Public Accounts Committee There was a hearing in October last year, and I was asked if I would write to the Public Accounts Committee setting out our progress in terms of appointing inspectors and analysts and the impact that that would have on the delivery of our programme. That's covered again in the performance report later this morning. And the letter that I sent on the 19th of July to Meg Hillier as Chair of the Public Accounts Committee is attached to this, and that in that sense puts that into the public domain, and then it's absolutely transparent and clear what we've been doing. The fact that we've monitored this on a monthly basis at this board it was part of the submission. Last night we had David Hoare, who's the current chair of Ofsted, at the pre-board meeting dinner, and so talked a lot about our relationship with Ofsted around children's services. And this next paragraph 6, talked about some work that Alan Wood, a former Director of Children's Services, former past President of the Association of Directors of Children's Services, was asked to do by the previous Secretary of State for Education in reviewing children's safeguarding. Alan has now concluded that, published his report. Governments have accepted his recommendations, and there is a bill going through Parliament on children's services and social work, the Children and Social Work Bill, which will pick up some of the implications. I think it's been heavily amended in the Lords. We'll go back into Parliament in the next session, into the House of Commons in the next session. But it will have implications for the work that we were talking about last night, the work that Steve and his team leads on in relation to children's safeguarding and the way we work with others. So it is something that the parliamentary team will track as it goes through. It's a lot of political attention in our world goes on to the NHS. This doesn't get the same political attention, but I think its possible consequences for us is significant, and therefore I think we need to track that through. Paragraph 7 talks about the work that we are doing with NHSI to secure closer alignment between their oversight framework, which they're currently out for consultation on, and the work that we've been doing in relation to the development of our own framework, the 5 questions that we ask. Relationships are constructive, and that's going well. And Malta and his team are actively involved in those discussions with NHSI about this. Peter and I had meetings with Chair and Chief Exec of NHSI at the beginning of this week, so we'll continue to work on that. I think there is more work to be done. This isn't a finished or a settled position, but it's important work. When this report was drafted and came out last week, we'd not published, it had not been published, it's not that we'd not published, it hadn't been published, the Action to Strengthen Trusts and CCG's Financial and Operational Performance in 2016, which got reported as financial special measures because a number of organisations, hospital trusts and CCGs, went into financial special measures. That material is now in the public domain, and those trusts which are in this position have been identified, and that work will continue. So I just wanted to let the board know that, again, we'd been involved in those discussions in anticipation of that announcement. And although the reason why these organisations were placed in special measures was due to finance and not to quality issues, it was important that we were closely involved in the finalisation of that guidance and the decisions. So, our annual report was published on the 21st of July to Parliament. That was, I think, the very last day before Parliament recessed, and I think all the arm's length body reports for DH were launched and published on that day as well. And then the last, in terms of work we're doing with others, last week we published a statement of intent around the way we'd involve with vanguards and new models of care in the NHS, and it's an important statement to make at this particular point in time, because what we were saying is often this claim that regulation gets in the way of innovation and change, and we wanted to make sure we got a pretty clear and unambiguous statement out at this particular time of year, saying that our work with new models of care will be guided by 3 principles: listening and learning, supporting innovation, and working with national regulators and others, systems partners, predominantly NHS England, and but also including Health Education England in relation to some of the workforce issues. Effectively, what we're saying through this is we've not got all the answers for how we will regulate some of these new models of care, because some of them aren't there yet by definition. But the listening and learning is we'll engage with them and be alongside them. Malta and his team organised a workshop internally also last week, the day before we launched this guidance, where we had about 40 inspection managers, heads of inspection, deputy chief inspectors, all of whom have some link or connection with some of the new models of care. And the purpose of that was to ensure that we'd got a consistent approach to the way that we engage. And so the statement of intent was really setting out the principles of that engagement. So quite an important piece of work on our in my view, because what we wanted to avoid is in one part of England we say we think that's a really good idea, and in another part of England somebody's proposing to do something similar and we say I'm not sure that we think that is a good idea. So we really do need to think this through in real time, and that should be consistent in the way that we move forward. Since our last meeting we've appointed Dr. Henrietta Hughes as the National Guardian for speaking up freely and safely within the NHS. Henrietta will begin in that role in October, although I think she's beginning to make contact with people here and others to take on that role. New ministerial team appointed, which we've covered, and that will be known about through other routes. On Brexit, I thought it was important that we just remind ourselves as an organisation that we've got over 100 European nationals who are employed by us, and given some of the emotion around Brexit and the way that that discussion has been conducted, one of the things that we've tried to do, and I've certainly tried to do in my messages each Friday, is actually say these are valued colleagues who have a place in the organisation, particularly in the context of some of the debate which has taken place, where people have not felt valued and not felt that they've had a place. So it's important we continue to do that. These are all people that make a contribution to the organisation. And in addition to that, we have a number of non-EU nationals who also work here, who also make a contribution to the organisation. The decision that I'm asking the board to consider this morning is in relation to the schema delegation that's set out in paragraph 14. And at the minute, if we're going to do a section 48 investigation under the Health and Social Care Act, the decision is with the board in consultation with the chief executive. And what we're asking as a result of a review of delegations that has gone on over the past couple of weeks or so, that we flip that round, that I make that decision as an operational decision and do that in consultation with the board. If I come back to that at the end, Peter. And then I'm not going to present paragraph 15 at all. We've had a full month, in effect, producing a number of reports, in the NH report, the Learning from Serious Incidents, the Safeguarding report, the Integration and Care of Older People, and the Data Security Review have all been published in the past month or so, and I just wanted to put on record that they're there. They've been considered by the board, there's been press release, and there's been discussion about those. But again, I think some very, very important pieces of work from my point of view. I think making some important contributions to our role to encourage improvement. I think there's some important highlights of good practice that people might consider about how they can build a platform of improvement in the services for neonates, how investigations are taken forward, etc., etc. So important. So in summary, it's been a busy month, and I think the report captures a lot of what people will know about, financial special measures and things that they might not know about, the review, the Children and Social Work Bill. But if I could ask the board to consider the item on delegations, Peter. Thank you.
Thanks, David. Are we excuse me, are we happy to approve the change to the scheme of delegations? Robert?
I can see that almost all these are operational matters, and therefore it seems entirely appropriate. I just wonder, and it's just a question more than anything else, whether there's anything in this list which requires a decision which affects the use of our own resources in a way which potentially affects our strategy or business plan or whatever, in a way which we ought not only to be consulted but actually take the decision. But in other words, whether there's anything in the list where there's a danger of executives being bounced into something because, with all due respect to ministers, had a bright idea at short notice.
There is a bright ideas sentence in the business plan, so in anticipation that this might occur. Yeah. So I think what we did in this year's business plan is set in the priorities under voice, I think it was, Malta, that we would have the capacity to do some Section 48 reviews, and there's also a place marker in for if a request comes through. I was just reflecting, it was the last bank holiday, August, that I was approached in relation to the data security review. So I think we just need to be realistic and plan that might be an ask that comes through if there's a requirement. I think if we felt that this was something that was a challenge to the resource assumptions that we'd made, we would bring it to the board. That's the in consultation with. The in consultation with is whether we use the board meeting or the weekly update. I think it's not something we'd go away and do. It is in consultation with the board. It's not a reserve for the executive to make that decision. I think the neonates report, we use Section 48 powers to do that. So I think there is a sense that we're moving away from some of the big set pieces where we're asked to do something and actually using this more flexibly, because it does give us some flexibility to look at commissioning as much as it looks at provision. So about 3 years ago, we had Steve Bundred do a review of Section 48, and he said, don't use this as part of an escalation tariff, use it as a strategic tool. So it's a flexible tool that you can use. So I think we'd want to continue to do that rather than see it as an escalation or we just do it in response to something. But we would, shorthand is, we would bring it back to the board.
Thank you.
Okay, so are we happy to approve that change? Good. Thank you. So that's done. So the rest is to note, but obviously, does anybody want to raise any questions? Jane?
Excuse me, a couple of comments. Item 8, the NHS paper on financial performance of trusts and CCGs. I know it's trusts particularly. It would be interesting to know, is there a correlation between what we find about the quality of those trusts that are also in financial difficulties? Is there a direct correlation, as in, they're not good on money and they're not good on quality, or they're good on quality and they're poor on finance? I would just be interested to know how that works. And the other one was about the new models of care, just to say that Health Watch across the country are very busy trying to make sure best they can that there's a really strong public engagement before, during and after the STPs. So we're working very hard, and we're grouping together so that we match those STP footprints. But there's my points.
Thanks. David?
Correlation on, we can't speak on CCGs because we don't hold that information, but correlation on the acute trust, Barts, Croydon, Maidstone, Tunbridge Wells, Norfolk and Norwich and North Bristol. The answer is yes, there is a correlation. And we've done the analysis which looks at the ratings from outstanding through to inadequate. And those outstanding trusts have smaller debt or no debt, and those that are rated inadequate have the largest proportion of debt. So this pulls out what we already know, that good leadership and good management will attend to quality and money, and less than good leadership and management, there's likely to be a problem in money and quality.
Michael, come.
Yeah, as it happens, Barts was inadequate and the other 4 requires improvement. But the issue, I think, I don't know if Malta's got any news on this, about the 63 trusts that have a so-called pay growth opportunity, or effectively are being asked in strengthening financial performance and accountability to reduce pay. Do we know about those 63 yet, or are we still working on that, Malta?
So we've done some initial analysis which shows that overall the pay growth opportunities, I think it's called in the document, exists both for trusts across the spectrum. So there's no huge difference between trusts that are good or rated requires improvement in terms of how much pay growth opportunity they have. That differs a little bit for inadequate and outstanding trusts, but we have to be careful because of the smaller number of trusts at that point and how statistically significant that would be. It's a result I would expect because of the complexity of the reasons why a trust might have a pay growth opportunity, and not all of them will be directly related to our quality findings as a result.
Just going back to your point, Jane, I mean, I think personally that whilst there is a correlation, I don't think we understand the cause and effect. I think this is really quite complex. So a trust that has financial difficulties, which may or may not be of its own making, is likely then to have quality difficulties, I think. So it may be simply that they're just bad at managing both the money and the quality, but I think it may be a lot more complicated than that in some cases, or every case. So I think there's some more work to be done to understand the cause and effect. Sorry, Jane, yeah.
And perhaps that might be a useful focus of our work with NHS improvement then.
Absolutely. Sorry, Robert.
Just on the same subject, prompted actually by the phrase pay growth opportunity, which, if I understand it correctly, is the exact opposite of what those words imply. Clearly, financially challenged institutions, of which we've now they have been identified, will be under considerable pressure to produce their staffing costs, and at a time when we seem to have no standard by which to measure appropriate staffing levels. And I wondered how we, in conjunction with NHSI, were proposing to deal with that. I know that Mike, if he were here, would say we will carry on inspecting to the same standards, but it seems to me we're entering exceptional times where that may become more and more difficult if we don't have a standard by which to understand whether staffing is adequate. And chief executives don't have a measure by which they can rebut the charge that their deficit is due to overstaffing.
I talked quite a bit to Mike about this, and he would say exactly what you've just said he would say, that we never were slavishly following 8-to-1 or some other safe staffing guideline, and that Mike and his team do have a good understanding of what is safe and appropriate, and we'll stick to that line. I've made very clear, as has Mike and David, that we are not flexing our own approach. As I was saying to a group of people the other day, we're not going to have rating inflation now. It's all much more difficult. We're not going to say what was good is now outstanding or something like that. So we stick to our knitting and hold the line. But that is going to put providers in a really difficult position, because you're absolutely right. The pressure on them now is to reduce staffing at a time when demand is going up. So I think it's really difficult, but I am absolutely clear, and as I chatted to Mike quite a bit about this, that we stay exactly where we are. We know what safe is like, and that's how we continue to measure it.
Well, I think it's necessary that we make that clear, because I'm not sure it is clear in all quarters that remains our approach.
David.
So when the press releases were done for the financial special measures, there were 3 quotes, one from NHS England, one from NHSI, and one from me, making the point about the importance of maintaining quality. Yesterday, Polly Toynbee did an article in The Guardian which prompted me to write a letter saying we will continue to focus on quality. She might take the position she's doing, but our job is to focus on quality. And as Peter and Mike have often said, we're not operating a fixed formula. We're actually arriving at a judgment. And the key issue yesterday is, and this is difficult for NHS boards, but this is why boards are there, to balance the requirements and the demands, the resources they've got, against the standards that they need to set as a board and take responsibility for this. And we do have a responsibility to assure ourselves about that, but boards also have a responsibility to arrive at those balances. And I think it is important we continue to work in a way that boards feel that it is their responsibility and they can take that action. So because they are ultimately accountable for the quality and safety of what's offered in their hospitals, and that's why there are directors of nursing and medical directors on boards to actually provide that clinical and professional advice as well as the financial advice. Is it tough? It is tough, and I don't think we should deny that. But I think the danger is we start losing what our focus is and why we've been put into the system and what our job is. So that what we're going to do is hold on to what our role is, but not pretend that this isn't tricky for some organisations. So that's a balance we're trying to strike, Robert, but it is a difficult one to strike. And, we do get complaints from trusts that say our inspectors are applying a formula. And so we need to ensure, part of our own work is to ensure that there isn't a gap between what we're saying at a senior level and what's actually happening on the ground as well.
Just to sort of reinforce that, I've heard both Ed Smith and Jim Mackey say very clearly that they recognise the responsibility for running the trust is with the trust board. So exactly, their approach is exactly the same as ours. We're not running the trust. They're not running the trust. We have our responsibilities, NHSI have theirs, but ultimately this balance has got to be run by the trust board. And it's really tough at the moment, really tough. But that's, both NHSI and ourselves are in the same place on where the responsibility lies. Paul.
Thank you, Peter. I think this is probably one for Malta. In terms of our intelligent monitoring and in terms of our approach to risk-based identification of trusts that need to be inspected, how will we feed this particular aspect in this pressure into our assessment process?
So I think there's two parts of the question you raised. One is how do we feed it into our risk assessment or understanding. The first thing to say is that, going back to Peter's point of the complexity of factors, because there is not, once you look at an individual trust, there is not a necessary correlation between sort of financial situation or position and their quality, so we can't use it as a predictive factor, for example, about their quality. At the same time, of course, as part of the intelligent monitoring, developing insight, the information that we have about a service, including through conversations with NHS Improvement and their ongoing engagement on the use of resources and finance, will feed into our understanding and the pressure that raises. But I expect that will be on the qualitative side of information rather than quantitative, predictable indicators. The other part of your question, I think, was in terms of how we assess that, and it's the ongoing work we're doing with NHS Improvement to develop an assessment of use of resources, as we committed a while ago to do, and the aim for that is to focus primarily on the use of resources and understanding of the productivity of information alongside the financial metrics such as position and deficit, which I think this focuses on at the moment. So we would like to have a coherent picture of financial standing alongside the use of resources and ongoing business as part of that. Does that answer your question, Paul?
I suppose what I'm wondering is if you've got a reduction in resources through the pay growth opportunity, are you automatically seeing an increase in risk in those potential increase in risk in those trusts? And therefore, does it push our trust up our list in terms of where we would want to go and look, inspect?
I think the thing that's being squeezed at the minute is access. So I think so if you've seen the debate in the press, it's about A&E times going up, waiting times going up. So interesting in terms of Robert's question about this balance between quality and finance, one can visualise this as a triangle between quality, finance and access. And I think the risk from our point of view is that if you hold access and money, it's quality that suffers. If you hold in money and quality, it's access that suffers. And I think that's what I would see the evidence from the reports coming through is that it's the access that is beginning. So this is Peter's point, I think, about just how complex this balance is for people to strike. I wouldn't want to say, Paul, whether people's risk registers are changing in light of the ask that is being made of them in relation to money and finance. But it is something that I think we need to attend to, and certainly, as Malta said, I think what we are in the insight work is more confident about what some of the predictive indicators are. They're not predictive of themselves, but they do cause the questions to be asked, and I think we need to be alert to will quality suffer, and I think we'd be silly to deny that that isn't a potential risk. But at the minute, I see the evidence as being waiting times increasing. There are times in A&E increasing where people are trying to hold on to quality and doing their best to hold on to quality and balance money. And I don't know. If I was trying to run a trust at the minute, I think that's the balance I'd be trying to strike, to be honest. But members of the public and politicians in particular think the access times are important. So I think, it's a very finely balanced discussion about it. But I think we do need to take this into account in the way that we do it, and a lot of the methodologies is how we take this forward. I think the dilemma for us is, do we allow for it being a tight financial environment? Well, we don't do it in adult social care. If you're providing care for heavily dependent people with dementia, we don't say money's tight, it's okay, let standards slip. Thanks to Robert, we have something called fundamental standards, which is the floor below which they should not fall. And I think it is our responsibility to apply those, and I think it will become uncomfortable for us over the next 2 to 3 years holding on to that standard. So we can't ignore the money, but by the same token, we are here to ensure people get access to good quality care, and services don't fall below a standard which is not acceptable. And I think we just need to keep saying that to each other and to people out there.
But David, I think, as you know, I wrote to you and Peter and Malta with my own feelings on this, because I do think this is a fundamental challenge for us. Part of the problem is NHSI throws around our name relatively indiscriminately. In the annex on pay bill growth, with, as Robert says, this Orwellian term, pay growth opportunity, it actually says NHS Improvements Review of Pay Growth, working in close partnership with CQC, etc. Well, are we part of NHSI's review of pay growth, or are they using CQC to make this review of pay growth feel more acceptable? I don't know. I mean, of course, we don't see their documents in advance, but it is, as I say, this is the phrase that's used at the beginning of the annex on the pay bill, or the so-called pay growth opportunity.
I think NHSI have been given the task of trying to get the system back into financial balance. And I'm not really competent to speak for them, but certainly the things that I've heard Ed and Jim say are much more subtle than I think is sort of coming out. So even in the sort of pay area, they are not saying this is the only way you can reduce costs. And I've heard both of them say to other people, if you've got in your trust, if you can find other ways of getting yourself back to a financial balance, that's terrific. And then they've cited things like setting up joint pathology labs and back office amalgamation and so on. Now, whether any of those things can happen quickly enough to produce the savings that in the time, I don't know. But I think it is a much more subtle approach than perhaps been suggested. So I think the important thing for us is to understand what each trust is doing, and clearly, if they are slashing and burning staff numbers, then what is the consequence of that on quality? That will be really important for us to understand. So I think it's a complex area. But I mean, exactly as David said, and as I said, our brief, our mandate from the Act is absolutely clear. We hold the line. at what we think is acceptable. And I'm afraid the push is then back to the trust to work out how they square this circle as best they can. Malta, go on, and then we'll move on.
And just to be clear in the understanding, Michael, because you pointed out that that section. So the analysis of the pay growth opportunity is that of NHS improvement, so we haven't been involved in that, and quite rightly so. The reference to working closely with CQC is about how and the work that then NHSI takes forward with trusts to happen in the context of our inspection findings and our views of where trusts are on quality. So that is how the reference to CQC in that paragraph is intended, but if it didn't come across that way, it's helpful to clarify for that. Thank you.
Yep. Thanks, Malta. I mean, we could spend all day talking about this, but are we happy to move on? Should we talk about our own financial performance?
That's me again, I'm afraid.
You're leading, yes, although you've got some supporters sitting down there. Kate's there if you need some.
So I think first up we've got the performance report. I'm going to do this at some pace, and I'm not going to present the annexes, although I do realise colleagues might have questions on the annexes. So on the inspection programme and inspectors in post, our performance on inspectors in post is good, and consequently our performance in delivering on the inspection programme continues. I'm not going to present the detail, it's in there. Both Andrea and Steve's performance continues to move towards delivering a completed comprehensive rating inspection programme during this financial year. Hospitals have completed the NHS Trust programme on time and on target, and are now busy in relation to the independent healthcare, and good progress is being made there. So that performance is holding up. On registration, there is some improvement over the previous quarter of over 8%, which is good. The volumes of activity are high, and so that's a significant improvement and is very positive. But the timeliness is still under target, so the work we're doing to improve registration continues to be important and a priority. In relation to do those services that we've rated inadequate or requires improvement improve, we've set out the performance during this quarter, and it's currently running at 47% in adult social care have not changed on re-inspection, but 45% have. Of the 4 trusts inspected, none of them had changed their overall rating. And in PMS, 45 of a total of 61 re-inspections had resulted in improvement. So a mixed picture during that last quarter. On inspection report timeliness, progress is being made. I think the effort that's being put in all 3 directorates is beginning to reap some improvement and some reward, but there's still further work to be done. And the significance of this is closing the gap between the actual inspection itself and providing the report so people can make informed choices about services. And that's why that particular indicator is important. A fair amount of work has been done. I think we had a full discussion at the May Board meeting, if memory serves me correctly, about services which had been where there were concerns and there were breaches of the regulations, and those breaches had been in place for more than 12 months. And some work is being done to actually cleanse the data. We think some of that is due to out-of-date data. And there's a piece of work. If you remember, this is very similar to the safeguarding issue we had about 24 months ago, where Sally Warren led very well a piece of work to cleanse the data, and we chased a lot of redundant data out. And I think there is some evidence that that is the case here. Debbie Westhead, who's the Deputy Chief Inspector, who's leading our work across the organisation on enforcement, is also going to look at this in much the same way that Sally did last time, and I'll be looking for Debbie and the Enforcement Oversight Board to be bringing some work to the executive team that we can then reveal in the subsequent performance meetings. The issue here, and a number of colleagues and colleagues not here today have raised this in the past, is what does this say about our impact if services have been outstanding, of not performing to the level they should be for 12 months or more? What are we doing? And you can see from the report a significant number have inspections planned over this next period, but there's some that don't, and it's likely that they're the ones which is there's an anomaly in the data that needs chasing out. But we do need to make sure that all those that we are concerned about and taking action about, we have a plan for, and we're taking that plan through. And this data at the minute, I can't be confident in advising the board that there's a plan in place for each one of those. So we need to make sure that there is, or that there's numbers in here that actually have some active work going on. So we need to clear this up beyond any ambiguity which is in this report. So I do want to flag that because of it's an important issue. Staying with enforcement, then going on to the enforcement paragraph, again, I think there's good work here, a much more focused and concerted approach to enforcement activity, and seeing this through. The board will be aware that we were given powers in relation to prosecutions under the health and safety legislation, which during this quarter resulted in the prosecution of a care home following the death of a resident, and I think there's a further prosecution for later this month, I think, and there's a number into the autumn which we'll go through as well, which I think are significant. And indeed, the one that resulted in the prosecution was an in-house prosecution from Rebecca's team working with the inspection team in relation to that, which I think is an important development and arises as a result of the investment that we've made in the legal team. In terms of internal assurance, business planning, strategic and operational risks, I'm not looking to gloss over those, Peter, but I don't intend to go through the datas there. These aren't changing greatly from one month to the next, but my colleagues will be happy to answer any questions on those, I'm sure. And if I do the financial, and as you said, that Kate's here as well, there's a fuller report and a fuller slide deck attached to this, but if I present it all at one, then currently at the end of June, we were 1.7 million underspent, that's 3% on the revenue budget, and 2 million underspent against net expenditure once we've factored in fees and depreciation. That's broken down in the annex to the finance report into pay and non-pay, with some explanation and detail in relation to that. The next forecast will be presented to ET. Is it next week? Yeah. Is it the 2nd of August next week? And we're also working on the capital approvals, where we've got 8.9 million through to date, and we've spent 1.1 of the capital during this year. We've got later today a report on the IM&T strategy, which has a direct relationship on the capital expenditure. So we're busy prioritising bids against those, and Eileen will oversee that work during July as it goes through. But I think we'll be happy to answer any questions. As I say, colleagues can pick up those on performance, and Kate can pick up on money.
Steve.
Thanks. If it's okay, Chairman, I just want to add a little bit of detail about the breaches of the over 4 quarters, because we take this very seriously. We only have, in PMS, which is GP, dentistry, 111, out of hours, etc., etc., we've got around about 22,000 or so locations. We've only got 192 who've breached over the year, over the 4 quarters. And I thought it might be helpful just to tell you what we're doing with them, because it has been a concern. We know every single one of them in detail and have a plan for everyone. 49% of those already have an inspection date scheduled, which leaves 97. 30 either don't exist or are going through deregistration issues. So that's one of the data issues, because it takes a while to get them off the register and deregistered. 25 of those have a data quality issue between the old regulations and the new regulations, but we know exactly what they are. And that doesn't need an inspection. It's just as we go through to sort out some detail. And that means we have 22 left. The final 22 have a plan for each of them, and some of them will be inspected and some will have desktop reviews within the next month. And each month we review that on a Friday before my own performance meeting, because obviously as we're going through having more practices in special measures and requires improvement, the number is increasing up to 1 year, and we've got to make sure we keep that at a minimum. But I think 192 with a plan for each one is only a small number. Of course, if it was a serious issue, we'd be intervening way before the year. It was just to reassure you as a board.
Thanks. It's very interesting sort of to see how it breaks down. Thank you. Colleagues, anything? Robert.
Two questions, really. One on independent hospitals, which I'm glad to see we seem to be making progress in inspecting. I don't think I see anything here about what the outcomes of those inspections are. Is that because we haven't reported on any of them yet, or is it? And Mike's not here, so we probably.
That's right, Robert. I think so. If when the full trusts were completed at the end of June, I think the people then started doing the independent healthcare. So on the rhythm that these will be done, I think some of the inspections are done. I think the report is talking about the percentage progress. I can't remember the number off the top of my head. 140. Yeah, but I think it's this is why the report timeliness becomes an issue about how long it's taking us to produce reports. So the end. Some of these were done during June, in fairness, but I think it's those reports we start publishing.
Yeah, it wasn't meant to be a criticism, it's just because I understand it's just simply that it's a sector which perhaps understandably we're only just getting to, and it would be interesting to compare and contrast between it and what we've been finding in the National Health Service.
Yeah, and I think there is concern that there's risk there, and I think that's going to work its way through as we go through.
The other question was on the money. Good news, I suppose, that we're underspending, but does that also mean we're not doing things that we anticipated we should be doing? And is that a problem?
Do you want me to?
I don't think so.
Kate can come, but I think what you should have confidence is that we are really concerned about making good use of public money, so we are questioning what we do and making good decisions about travelling, about using rooms, and about sometimes the size of what we do. So I think it's really having a tight focus on how we're spending and what we're spending, not that we're not using our resources properly, Robert.
Yeah, no, I understand that you can't get it right, but either we're spending too much or too little. But as we advance into a fee recovery regime, then it's important to know that we've got the budget, getting the budgeting right.
I think the most important thing, the two important things, and Eileen's really mentioned both. One is that we have the resources to do the jobs we've got, and the second is that we do it as efficiently as possible. And I think what we're seeing at the moment is further efficiency savings that are absolutely not jeopardising our ability to do the job. And I think at a time when the whole of the NHS is under such acute financial pressure, it's really right that we concentrate on that efficiency. But to your point, not at the expense of being unable to do what we're tasked to do. So I think we're in the right place at the moment. Yeah. Kate, hello.
Hi. I don't think I have anything further to add, really, other than to say that I don't think we're doing anything or not doing anything that we should be doing. We've had a tremendous response from staff in terms of the cost savings that we need to get out. People have really kind of taken on board, particularly in the inspection directorates, the need to travel. We've got really good budget holder engagement. We've reduced our meeting room budget partly because of the move to 151, which helps. We've got better training on the use of technology, so that again reduces the travel and subsistence. So it's all good and real savings that are coming out, and I'm delighted to say they're coming out a bit quicker than I'd hoped.
Thank you.
Thanks. Any other points on the financial performance or the performance? Jane. Okay.
So not a terribly heavy point, but in a set of meeting papers which are for a public board, when I read the sentence, the main area of concern remains the TNS associated with SBA usage and PMS, a deep dive review of which is being carried out, I thought, blimey, I don't know what that means. I just wonder whether a gentle reminder to people writing these papers that not everybody speaks that sort of shorthand. Plain English would be wonderful.
I think you've just delivered that gentle reminder. So, thank you, Jane. Paul.
Thank you, Peter. Just one small point of clarification again, because it's in the public papers, where we talked about the business plan commitment for ASC and for PMS to complete by the year. I think our business plan commitment is to complete the inspections by the end of the year, and if possible, get all the reports out by that time, but not to necessarily get all the reports out. And we do say here the business plan commitment is to complete rating all ASC and PMSs, which presumably the inspection will be complete, but whether we've actually rated and got the report out will depend upon whether we hit our earlier timetable in that respect. Is that right?
Yes, but that's one of the reasons why what we're working on internally is to actually complete the inspections by the end of January, so that we can be confident of getting the inspection reports out, but it gives us the scope to be able to respond to risk as well. And certainly we will be finishing the programme earlier in different parts of the country, depending on levels of enforcement and recruitment, and sharing about resources so that we can complete across the board.
Okay. Anything else anybody wants to raise? Perfect. Good. Thank you, David. Thank you, Kate, as well. David, I'm afraid it's you again. It's the experts by experience, please.
Okay. Previously been an item which has been the subject of discussion at the board now for a good few months, both in public and private session. We gave a commitment at the turn of this year to hold a lessons learnt, given the controversy that surrounded the experts by experience. The report that you've got today is as a consequence of that lessons learned exercise and the drawing together from a meeting that Paul kindly chaired on the 20th of April from memory at 5 o'clock after a very long board meeting. So thank you to Paul for that. So what we're doing today is bringing this back to the board, because our commitment internally to you as a board, but also to experts by experience, that we would do a lessons learned and bring it to a public board meeting, and then we were seen to be transparent and learning from the experience that had arisen. So I'm not going to go through the detail of this report. You can see that the report is split into sections on procurement, where there's an analysis of what the key issues were, an analysis of the issues around TUPE and how that was dealt with. There's then lessons on terms of the procurement timetable, the way that the evaluation was undertaken, and this issue about whether it was clear about payment levels as part of that evaluation, how we managed a change of contract. It's under the heading management of incumbent suppliers exit, but how is that dealt with both now and in the future? How we communicated to those people who are experts by experience that were the subject of these changes. And then lastly, how did we deal with deployment and new contracts and mobilisation. So I think the end of the report has some pretty important lessons learnt that we've extracted under those headings. So I think on procurement timetables, our timetables were just too tight. We were trying to do too much too quickly and squeeze in things which should have taken more time, and that left insufficient time to both plan to communicate, to ensure the governance processes were in place, to ensure the appropriate project management resources were located, and work out what the resulting implications would be for the service. Some of that was driven by the fact that this contract had been extended and extended and extended and got beyond the elasticity of what could be extended. So there's an important message in there about not extending contracts and doing this in a timely way. And I think Mafeking is being relieved by Chris and Annette coming to join us, who've done much of the bulk of this work. So some important lessons here about how we deal with the procurement timescales and ensure that we're not trying to do in 9 months what effectively is an 18-month exercise. And I think that should be one of our key learning points that we take out of this, about the importance of doing this in good time. So I think we do refer to a register of our contracts which allows us to do this, so these things don't creep up on us and we've got an end date where we're then forced to try and do work in a constrained period. The commercial evaluation and payments to experts. I think, again, one of the key lessons is about how we deal with the split between variable and fixed cost and what assumptions are made around volunteers and the impact of this on variable rates. And I think that would allow us to engage in a different way where there's an impact on pay changes and the broader impact on volunteers, an important issue. Again, a pretty important lesson about impact assessments and the importance of doing impact assessments up front and being really clear up front that these are important ways of actually assessing the impact of the decisions that are being considered, and allow a full understanding of the requirements and potential service and commercial implications up front. Impact assessments were done in this, but I'm not sure they were as prominent at the beginning of the decision-making process. And again, a lesson, I think, for the executive team and perhaps for the board about us needing to do that much more prominently up front. And that also turns to this point about the adequacy of resources for this. We have strengthened the procurement team under Annette, but I think it's not just about the procurement team, it is about making sure that the policy ambition is clear, that there's appropriate project management for the delivery of these up front as well. TUPE and payments. I think colleagues were in the board meetings when this contract was considered know that TUPE was an issue about did TUPE apply, did TUPE not apply, what were the obligations, and I think we've now already made changes around being really clear in our contracts about where TUPE sits in relation to this and how they should be dealt with. We are going to get to the end of contract, so this is an issue that's going to repeat, so we do need to take this and build this into the way that we operate, and some of those changes have already been made to ensure that those clauses are in position in our future contracts. We do need to look at suppliers' exit. Our contracts haven't hitherto had exit clauses that we can use. So if you remember, there was this debate about who said what to whom and who put what into the public domain, and actually there's more that we can do to ensure that we've got some standard provision around exit clauses. And again, that's a change that has been made that we'll build in. I'm not sure that communication either by the contractors or by CQC has been everything it should have been during to the experts. I think we have been on the back foot, and clearly there's more that we can do, but also part of the discussions that we've been having with employees about how can they be more engaged and more proactive in relation to communication with experts by experience. Still on the timetabling issue, I think what this report is saying and the conversations that we've had is that we do need to allow more time that allows the supplier of the services that we're contracting for to change and for them to be clear about what the impact on frontline services are. It's not just our timescales that we've squeezed, it's their timescales as well. and it's an important issue that we need to take into account. I'm repeating the point that I've already made. I think what we've tried to do here, Peter and colleagues, is actually have a pretty open and transparent analysis of what the issues were in here without being defensive. If we're going to learn from this and being defensive about this isn't the way to actually position it. I commend Annette and Chris for the work that they've done in opening up these issues and setting this out. I'm grateful to Paul. I think we've learned a lot, and some of those changes have been made around changes to our basic contract, and Annette has taken those forward. And I think this issue about mobilisation and allowing sufficient time and giving more prominence to the impact assessments are actually key points of learning. I think it is important to emphasise, though, that experts by experience are an important part of our operating model, our inspection model. The ambition that we'd got on and the contracts were at an end. We couldn't have continued with those contracts as they were. The ambition that we'd got is to secure better value from those contracts. And I think we should be clear to separate what that ambition was from the way that was executed. I don't think we should at all be defensive for securing better value from these contracts and actually securing that, particularly given the financial position we're in. But the improvements that are flagged in this report, I think, will help us to make sure we do this in a more timely way. We can engage people, communicate with people better, and give people a chance to go to mobilisation. So I think we have learned lessons from this. Some of the lessons have been put in place, and some of them will go in place as we go on for these ongoing contracts. So if I leave it there, Chris and Annette have joined us, so I'm sure they can answer any more detailed questions that I'm not able to answer. Thanks.
Thank you. And I was actually going to thank Chris and Annette, but you've already done it, so I won't thank you. No, I will. I'm very grateful. And it's really important. I mean, this was not, the whole purpose of this was not to rerun the whole experts by experience issue, as it were, but was to learn the lessons for future. And I think that this is a really good paper that will help us enormously. A lot of key points which we have been pulled out from this and we need to keep in mind. Paul, do you want to add anything? You may not, but if you do, please do.
I certainly won't go through what David's just been. I'll pull out 2 points, one of which David mentioned, which was the impact analysis, which I think is an important tool that we should be making more use of in the process, and we recognise that. The other, which isn't explicit within the paper, but I think is worth mentioning, is that we will get a lot of benefit from the medium-term planning exercises which are currently going on to look at how we convert the strategy into not just one-year business plans, but longer term. When those plans are worked through, it will give a better basis for both operations and procurement to understand what they need to procure and when they need to do it. And it will shorten the timescale at the front end of any procurement. It won't use up that bit which was used up in this case, where we had to halt the procurement for a period of time to get the planning right. So I think the medium-term planning that we're doing will hold us in good stead in that respect.
Thank you, Paul. Robert.
Well, firstly, just to say these recommendations are really good, and it's encouraging to see the open way in which everyone has dealt with this. Just moving forward, we must and do value our experts by experience. They're quoting our values, they're part of our team, and they're people we should care for. So I just wonder, in terms of the communication, this obviously is dealing with engagement with them about changes in contracts and so on, and clearly that's absolutely right. Do we have a process for engaging with experts by experience generally once they're, as it were, on the team, not just when they're going on a job, but in terms of communication with them, integrating them into what CQC is about and what we do?
Chris, welcome formally.
Thank you, Robert. We do, and there's sort of 2 parts to it. There's a part where we'll work closely with Choice Support and Remploy to make sure we share the communication directly with the experts that they work with and they employ. And we also want to ensure we maintain direct dialogue with experts ourselves, so we're able to communicate with them directly, because you say they're very much part of our team. So our aim is to do both. I think the lessons that we've learned in that regard are to make sure that we get consistent messages out early about things as they begin to change. So one of the conversations that we had with Employ directly was about having a weekly update for experts by experience that came out from us, that we would also make sure our own staff are aware of as well. So there's a link there, because often the ground conversations between inspectors and experts. So we wanted to make sure that that happens. So that's now in place and running well. And I think that's a lesson for us about how we can make sure that even through a difficult contracting process, they are people that work with us, and we need to make sure that we're able to keep that line of communication open.
Thank you very much.
Jane.
Thank you. I too, I think this report reflects very well on the culture of CQC. I mean, it's always awful to have to beat oneself up, but I think it's very open, it's very honest, and there are certain lessons to be learned. It's a slightly frustrating discussion for me, because Health Watch is about engagement, and this debate, of course, is about procurement. So I just to put the thought on the table that when we're talking about engagement, I really would welcome a debate on engagement, including experts by experience, in the future around this board table.
Okay, thank you. Chris, you heard that? We'll come back to that. Good. Anything else anybody wants to raise on this subject? Okay. I think it's a really, really helpful paper for all the reasons that have been said. Chris, Annette, thank you very much again for all the work that's gone into it. So we then move on to the RES report. Eileen, I think you're going to introduce this.
I was hoping for my very own Mafficking moment, because there are two people who I think would love to be here to report on this. But let me begin, and hopefully they will appear very shortly. So I think this is a really important thing for the board to see. It sets out a process that we CQC have undertaken for a number of years, which is to do a race equality audit of ourselves against the standard, if you like, and we publish this publicly, and we engage primarily with NHS organisations to look at how we're doing. And what you see set out here is how CQC is reporting against the standard for this year, and I think there's some pleasing areas of progress. I think just as importantly, and in fact perhaps more importantly for me, what we have is CQC being able to better understand issues which it historically has not had data available to understand and work with. And that really is to the credit of our People Directorate, who've been absolutely resolute in trying to get to good data to work with, and to our Race Equality Network, who I think have been fantastic in saying we want to work as colleagues in CQC to improve the experience and the opportunities for people who are colleagues who historically have not always felt that CQC has welcomed or encouraged them to move on and up in the organisation. So working on the basis that everybody's read the report, I think there's some very pleasing things in here, but just as pleasing is our level of understanding of what we know and what we know we have to work with. And if I would draw attention to one key success that came out of last year's report, it was to really work to get a strong mentoring programme in place. If Paul Corrigan were here, he would talk about the way that he helped to kick that off. We engaged with an external party. We've trained people internally to be mentors. Some people around this table are mentors. And it is having such a positive impact. And it was oversubscribed. We're running it again. It's going to be part of how we work. And we do ring-fence places for people who are members of REN or who would be members of BME staff, so that they can seize that opportunity, and we give them every encouragement to do so. And as I say, so far the report back on that has been fabulous. So I will stop there, happy to take questions, but I think for a board, a really important thing to receive, a really important thing for us to publish. If Farah, who was here, who's a member of REN, what she would say is she went to a meeting with very senior NHS colleagues who were talking about their RES the other day, and people presenting from a whole range of organisations, and somebody said to her that it's absolutely wonderful to see CQC leading by example on something like this. So we are doing really well, but we have so much more to do. There is no complacency whatsoever. I'll shut up now.
Thank you. I mean, another really good report, really important, and I think the summary is exactly as you just said. A lot of very good stuff here, but always more to do, so that's great. Questions, comments? Jane?
It's very interesting to hear that. I think the board, we've also completed one of these sort of questionnaires, haven't we, recently? So it goes from all across the whole organisation, which is very helpful. I was just interested in the Dignity at Work advisors. It says it's a part of the planning going forward. Continue to promote our cadre of Dignity at Work advisors. Just wondered how that was going and what was planned for that.
So CQC, like many organisations, has had Dignity at Work advisors for a number of years, and I think sometimes initiatives start with the best of intentions and they can slightly fade into the wallpaper. So what we have done is to re-energise that, and we're encouraging more people to become Dignity at Work advisors, and that's been fantastic in reaching out to people and saying, would you like to become, ensuring that we have more, that they're more representative, and that we are training and supporting them, because as I say, this is an initiative that started a few years ago and people are very passionate about it, and there is now very good leadership for it. And just, slightly, as I say, fades away, but really re-energising it. People are getting support. There are more of them. And I think it's a great part of our armoury in terms of improving, Jane, right across the board, in terms of people feeling that they can speak up.
David?
I think a couple of things just to add. One is they're all volunteers, so these are all people who want to use their discretionary effort to do something about this. And if you're in any of our offices, if you see somebody with a green lanyard as opposed to a purple one, then I think that flags they're a Dignity at Work champion. So they're the kind of go-to people in relation to that. So important. Oh, this might be Mafeking. Completely throwing any members of staff.
We are deliberately, just to keep everybody on their toes. Yes.
May I make a suggestion? Unless people have got questions, we don't want to dig too far. But I think Farah, who's a member of the Race Equality Network, it would be good to give Farah the opportunity just to give 2 or 3 highlights about how she feels the process has gone, because she's put a huge amount of work into it, and I think it'd be good for the board to hear and recognise that.
So no pressure, but welcome.
Thank you very much. We'd just like to say that we see ourselves at the CQC as a standard bearer for RES, and I think that the work that the Race Equality Network and that the organisational development team has done together has been really strong. Firstly, in terms of the way we've worked together, and there's been a significant improvement from last year, which is fantastic, and the way that we've been able to critically challenge and make sure that this document was as strong as it could be this year. I think the involvement of staff in the report, in putting the report together, has been crucial in terms of not just how strong the report is, but in terms of future planning and recognising that we've got now something that we can work forward with and that we can compare and contrast with in the future. We've recognised that there are definite improvements, which has been great. There are learning points that we have to work through for next year, and we've put an action plan together. Some of the highlights of those include developing a inclusion plan, a diversity inclusion plan, improving our monitoring, our mentoring and our data monitoring, for example. But we really want to ensure that the confidence of staff, the representation of staff, and the improvement of race equality across the organisation is something that we're focusing on, and I think that's worked really well. We presented this to our RES external advisory group on Monday. They were very pleased to see it, and they noted that we were leading by example, which was really great. And they've also offered to help us with effective interventions in our own RES plan for next year. So it's positive in many ways, but there are definite improvements and learning that we need to work on, and I hope that we can be back next year to tell you about those improvements.
You will be. Promise you that. You missed most of the discussion, but there was a very fulsome introduction from Eileen. And I just want to reiterate, I think it's a really good report and really good work that's been done. And I think as a board, we're very supportive of and grateful to you for what you've been doing. Andrea.
Yeah. There were just three points that I just wanted to make. But before I did, to start off by saying thanks to everybody for the work that's gone into this, and thanks particularly to Farah and Ruda for the leadership that you've shown to the Race Equality Network, which I think has been really very important for us. The three things really are picking up on the point that Jane made about the fact that we are now going to be monitoring what's happening at the board level, both non-executive directors as well as executive directors. And I think it wouldn't escape anybody's attention, either coming to this meeting or watching it on YouTube, that we are part of the snowy capped mountains of the health and social care system. And so as understanding that and understanding what we can do about that is really very important. The second point was just to pick out, to kind of demonstrate really for the board's benefit that to think that we're kind of not taking these figures at face value, and that there is sort of digging underneath them that we've got to do. So one of them that we discussed when we talked at the executive team was around indicator 5, which suggests that the percentage figure for BME staff experiencing harassment and bullying or abuse at work from people other than CQC staff is lower at 5% than it is compared to white staff at 8%. And just wanting us to think through how does that really look when we consider the publicly facing roles that people have, because I think that we can't kind of assume that that's a good indicator when we do know where people are in the organisation. So actually what is happening to BME staff who are inspectors going into places and potentially facing that. So I think we've got a bit more work to do on that, and that was accepted. And the third thing was just to widen. I know that we're concentrating on the RES report here and thinking about race equality, but I think that we're also doing some significant work within the organisation, looking at the experience of our staff who are disabled as well. Again, that follows up from the work that we did as a consequence of the staff survey, and did some further work around the experiences of people who are disabled in the organisation, and really looking to, in some senses, learn from the good work that we've done here, but also apply that across to thinking about the experience of disabled staff, what we can do better to support them, and what we can do better to support them in terms of their progression in the organisation. And with Paul's departure, I've taken on the sponsorship role for the Disability Network, and looking forward to working both with the Race Equality Network, but also our LGBT network, who have offered support to make sure that across the board we're kind of considering the diversity and the diverse needs of all of our staff.
And I think it was at the last board meeting I was making the comment about trying to have as great a diversity on this board as possible, as new opportunities to bring new directors onto the board arise. But also recognising there were certain skills that were needed. There were a lot of different angles to diversity, so we just have to see how far and how fast we can get. But I do think all forms of diversity add great value, so we do need to focus on that. Anything anybody wants to add or ask? Robert.
Well, firstly, can I join in the general congratulations on what looks a very good piece of work? It seems to me that one of the huge values of the figures is not the figures in themselves, and we can argue about 5% or 6%. It's the fact of getting people talking about these things. Unusually, actually, in these systems, does actually mean that eventually things will happen, which is the actual, often talking leads to nothing, but I think here talking is really valuable. But it's in that context, it's just prompted by a comment Eileen made about dignity at work champions as being part of the freedom to speak up. We know, at least my work seems to suggest, that BME employees generally, I'm not talking about this organisation, suffer worse in terms of the ability to be able to speak up. They get into more trouble for doing so. And I wonder whether how we're importing the sort of freedom to speak up agenda into what the Dignity at Work champions do, with a particular reference here, obviously, to the BME staff.
I mean, Farah and Tracy may wish to add, but I think we're very mindful of that, and I think the suggestion that came from the Race Equality Network themselves was to recognise first the importance of the Dignity at Work advisor role and how we could do more with it, and then to say actually a way to engage with BME staff in particular is to have Dignity at Work advisors who come from the BME community. And I think Farah will say, but we've had people volunteer, and so that whole network is strengthening, and so it's just more representative of who we are, and I think that's a first step, and actually talking about it, as you say, I think is absolutely critical. So we are talking about it, we are strengthening that network, giving people support, and we'll be continuing to communicate outwards into the organisation about the role and importance and what the Dignity at Work advisors' role is. And in parallel, we'll shortly be announcing, and David will be coming back to talk about the fact that CQC will have its own Speak Up Guardian. So it's knitting all of that together so that we are promoting the fact that we do want people to, I think in the first instance, have conversations where they're able to raise concerns. And that really, as you will know, if you can raise concerns early, it is by a great magnitude and great order the very best way to build a healthier culture, and that's what we're trying very hard to do.
Put your mic on.
That those issues in terms of freedom to speak up is something that we are aware of and that we have discussed, and that we are looking at implementing in our action plan. We've had conversations, and I take your point that talking by itself isn't enough, but we think that we have engaged in a way that we have tangible outcomes over the year in terms of turning that into some kind of reality. It's very important that our staff feel confident, BME staff, but all staff. And we hope that by understanding what some of those barriers are, that we can extend that learning as well, as Andrea is saying, across all groups. So it's definitely something that we are focusing on. We're very aware of that, and issues of openness and transparency in terms of how people are able to move forward. I think it's not just about staff confidence in terms of there being an issue, but it's also about staff confidence in managing those issues, and both of those sides in terms of staff development being looked at.
Great, thank you. Good. Really, really good report, but more importantly, really good work being done. So thank you again, and we will see you again. Good, thank you. Right, so we are making good progress. Rebecca, we have some terms of reference to approve.
Yes, I think that we discussed this in private session at the last board meeting, and we took away an action to do some further work on the terms of reference of the Finance Committee, which have now been tidied up, and we've put together terms of reference for the People and Values Committee, which sweep up those matters which, since the establishment of the Remuneration Committee, we didn't want to lose, but we recognised that we might want to have the People and Values Committee just meeting flexibly, and sort of align it really with the REMCO. So I think they've been seen by many on the board in circulation, so I hope people are happy to approve them now.
So I think that is exactly that. Now we've looked at this comprehensively, and we've got all the committees with no overlaps or gaps, which is what we need. So I certainly think we're in a good place. Is everybody happy to approve the terms of reference? Great. Thank you, Rebecca, for all that. I know actually quite a lot of work went into achieving it, so thank you for that, and anybody else that was involved with you. Any other business the board wants to raise? Okay, so we do have some time for questions from the public, and so on. I think you were the most disappointed last time for not being able to speak, so you can go first. So although we know who you are, would you like just to press on the mic and introduce yourself?
Good morning, Board. Thank you very much for letting me speak in July. My name is Cyan Irwin. I am a NHS whistleblower and a mother and a concerned member of the public. I'll let you off this morning, David. Don't panic. I'm not going to bring anything else up. Just on the matter of public engagement. We can have that by email later. Public engagement. The last time what I was going to ask was that you're all here and members of the public, I mean, David and I can get here because we're in London, but getting members of the public for parity of access to all, to be able to get to London, 9 o'clock start, for one member who comes here occasionally, is £153 return train journey. There's no NHS Improvement, although wherever else bet they do, actually do their board meeting at 1 o'clock. So we're not saying 1 o'clock, but is there any chance you could do it maybe a little bit later, that it would give a parity of access to anybody wanting to come from a couple of hours away, that they could buy a cheap rail return to get to the meeting so they actually have access because they don't really have it. And that if, like, you know, a lot of whistleblowers, as you well know, are out of work. They never get work again, so they don't have any money. If there was any way for expenses, for anybody to recoup some expenses if they were far outside London, that they'd actually have, it would give them access to the meeting, were the meeting to be a bit later. That would be really helpful. Parity of access should really be, for 64 million people, should be a real issue for you. So, dignity at work. It would be really nice for dignity for patients, which would be lovely. And just on your point, Robert, patients do suffer repercussions, as I well know, and many whistleblowers know. So if any carer, family member or friend makes any kind of complaint or concern, raises any kind of concern, guaranteed without doubt, every single time, patients suffer repercussions. So I've spoken to carers, as a member of the advisory panel, I spoke to carers all over the country in different sections, and every single time it's come to the point where actually we had to tell them not to complain, and that if they wanted to complain, to find a safe route around it, either do it through an advocate, do it anonymously, make sure the data was anonymised, make sure that the patient themselves wasn't set out, that it was a general thing, because if you say it, patients are moved far away, carers and family and friends are blocked. All these things happen. It happens a lot, and they're moved quite far away so that the carer is blocked from going to see them, isn't allowed in to see them. Stories are made up. It's a really, really serious issue. So for anybody out there, if you're going to make a complaint, for the God's sake, for your care of the patient you're looking after, do not make a complaint without using an advocate, and use it and anonymise it, because otherwise you're going to be in danger. Part of the res thing, just for maybe just an idea, the unconscious bias hasn't been discussed. So for the BME staff, there is really an unconscious bias that isn't really being openly discussed. So I know, as myself being an Irish person making a complaint, it certainly seemed to be a lot worse were I white in English as opposed to Irish, and you know, all those type of unconscious bias that live. Anyway, thank you very much. Have a lovely summer, and we'll see you again in September.
You will. We'll
you will indeed. We're coming every single month because I wouldn't much think you're going to miss us.
So your point about the board timing, let me just to take away and discuss it with colleagues. The difficulty is twofold. One, this is only one of a whole series of meetings that happen, and you heard earlier David refer to a meeting Michael was chairing at 5 o'clock. And secondly, sort of connected with that, quite a lot of the board members have very long journeys afterwards.
That.
So whether we can sequence things in a different way is
what I asked Andrea the last time was that I know you have another meeting after this.
Yeah.
And I was asking her, is the stuff from this meeting discussed in the next one? And she said not necessarily. So, I mean, could you even just flip them around, that you had your later meeting earlier and this one just that little bit later, so that people could actually travel? Now, I realise time is an issue, but just maybe even flip it around, that it would make access a bit easier, and would certainly give people that if you started that hour and a half later and then the meeting was going on for an hour and a half, it would be almost 3 hours in the time, so they would be well within the cheaper travel time to get here, and where time allotted or allowed, or where time there, they could maybe ask the question.
Yeah. No, I mean, as I say, let me take it away and think about it, that there are sequencing issues. And
yeah,
so
no,
on,
I know.
But we'll take it away
Okay,
and come back
you.
to you. Good. David.
While David's arriving, can I just pick up on the unconscious bias point? So we've had a pretty comprehensive training programme on unconscious bias, which I think something like 60% of our inspection staff have been through. So whilst it wasn't mentioned, a key issue about the race equality standard, we apply that standard when we inspect. So what that was about is that we need to apply it for ourselves, but unconscious bias, the Academy have put through a pretty extensive training programme that we did with the Equality and Human Rights Commission, who came in to do some external training on unconscious bias. So the unconscious bias training was for all staff about how cognizant of we of unconscious bias about the way that we as individuals go about doing our jobs at whatever level we are and whatever job that we do. So it is something that we think.
Okay, David.
I'm David Hogarth. I'm the coordinator of a befriending charity that visits usually older people in care homes and in their own homes, so we come into quite a lot of, we have quite a lot of experience of care quality, and we have come across ourselves quite a lot of abuse and neglect, which has led to why I'm here. I have had, since the last meeting, some interaction with Peter, and I think he may expect me to be speaking now about one of the problems, the problem of the possibility of care home closures and there not being enough places. I have a particular interest in this because the question in my mind is whether this is something which prevents the CQC from taking more effective action about the issue which concerns me. And this issue is that whenever a scandal breaks in the press or anywhere else, it isn't normally, or really hardly ever, because the CQC has discovered it or because somebody has come to the CQC and told them about it. And also, if you look back, as I did do, and I collected 42 examples of this, if you look back to the previous CQC inspection, you find no hint that anything is really wrong in the particular care provider. There's been a particular example of this recently in the last paper that I gave you, Laburnum Court in Salford, where the CQC were there last December and said that everything was good and that they were particularly good at recruiting, and then there was a scandal broke at the end of the month where one of the staff were describing a resident as describing all residents really as effing vegetables, and had also assaulted a bit. And it seems to me that the regulator, if a regulator worthy its name, should have got some hint that something was wrong, because that wasn't probably the first time that he'd ever done this. Now, I might be, what is to be done with this? Now, I might be associated in your minds with cameras, because I very often come here and sort of advocated the case of cameras. And it is true that a lot of the cases I collected for you were actually discovered by cameras, and a lot more of them, if there had been a camera, they would have been discovered earlier, and there are some people who would be alive now if that had happened. But I don't think that, in fact, cameras is the area where CQC has the most influence. You can only say that perhaps you could say that you liked cameras a bit better than you have, but you can't spend a lot of time putting in cameras. But I would like to see the CQC taking this a little more seriously and regarding this as more urgent than they do. I've been told, and I will agree, that it is there at some very high level in the strategy, but things take a long time to come down from the stratosphere. And I'd like to see you, while you are debating this, these things are happening. People are being called names, people are being abused, people are being neglected, their dolls are being tortured, as in Ashbourne Court. as in their hair is being pulled in the middle of the night, as happened in Beacon Edge in Penrith. And I think that if I were a member of the board, I would feel ashamed if I wasn't doing my very utmost to do something about this and do something about it really quickly. That's all I really want to say. And I've been told that the board has decided that the pace that you're going at is the right pace, that you don't really want to encourage cameras. I just don't feel you ought to be leaving it in this kind of, at this stage, and without doing something more quickly. All these people are dropping below those fundamental standards that you say, David, that you are maintaining. Every single one of those care homes that I listed in my report. And I just hope you'll do something about it.
David, thank you. As you rightly said, you and I have had various conversations since the last board on various matters. I'd just like to pick up a couple of points, then I might ask Andrea to say something. First, I'm really disappointed you don't think we're taking this seriously enough, because I absolutely assure you, every one of us around this table and our staff take this really seriously. This is why we're here. The question of pace is not because we think we can do this in a leisurely fashion, and I've never tried to suggest that. What I've said is that putting in new technology, which is part of the strategy, can't be done overnight. That's a separate issue from whether we will do everything we can to get as far as we can in stamping out all forms of abuse, whether they're in homes or anywhere else. It's what we're here to do. So I don't want you to go away with the impression that either I or my colleagues don't take this really seriously, because we do. Then the question is, well, what more can we do? And that's what the discussion you and I have been having around cameras and other things is about. And so we may have differences of view about aspects of what we could do, but it's not because we don't take this really seriously, because I absolutely assure you we do. Andrea, do you want to say something?
Yes, thank you. The first to reiterate, Peter, in response to David's comments, that we do take it seriously. My staff take it seriously, I take it seriously, and we do respond to the issues that are raised with us, and you can see in the performance report the increase in the level of enforcement that we're taking as a consequence of that. But I think that the key thing that we've got to remember is that the responsibility for making sure that people actually get safe, caring, compassionate, effective and high quality care rests with providers, rests with people ensuring that they are employing the right staff, that they've got enough staff, and that those staff have the time and the capability and the confidence to actually provide good care. We do see a huge percentage of good staff across the country trying to do a good job, but sometimes they are not supported by the provider, by the system within which they are working. And I think what's important for us as the regulator to do is to be absolutely clear, as we are in the fundamental standards and also in our characteristics and the key lines of inquiry that we pursue on inspections, absolutely clear about what we are expecting providers to be doing and how we're expecting them to be doing that. Reporting on that as we find it, and I think that our new way of inspecting, which is not just taking that snapshot on the day, but also thinking about all of the intelligence and the information that we have about a service to reach our judgment, and then rating that and being very transparent about that, and holding providers to account where we do find that they are failing. You know, as we have discussed ever since I came into post, I think you were at the very first meeting that I ever came to, David, even before I came into the job. We're never ever going to stop absolutely everything happening in 25,000 different locations, 20-odd thousand primary medical services locations, and all of the hospitals across the NHS and independent hospitals. I wish it were so, but we need to make sure that we are giving people the confidence to share information with us. We're giving people the confidence that if they raise those concerns with providers, that they can do so without fear of reprisals. That is the reason why, as David reported in the Chief Executive's report, we're doing the work on making sure that providers are clear about our expectations of how they respond to people who are raising concerns, because as Science said, there is a real concern that actually there will be repercussions, and that should not be the case. So I think there are a variety of things that we're doing, that we're trying to do. We can always improve. I know that I can rely upon you to push us along that path, David. And one of the particular issues that we are discussing within the team at the moment is how we look at the question of whether a service is caring, what more we can do to get under the skin of that in a better way, so that we can actually reflect on that better, both in our reports but also in the expectations that we set for providers.
Would you consider having the director of MI5 as your next pre-board meeting dinner guest?
I will certainly consider it. And I think at that point we will end the meeting. But it's a nice idea. But do stay and have a cup of coffee, and we can continue that. And board, we need to start again in 10 minutes' time with the next meeting. Thank you very much indeed.